everybody, and we are live. Once again, I am your host of the Bad Filipino podcast. Today, I have an extra special guest. Not only is he a dear longtime friend, he is a longtime chiropractic doctor who has been doing his practice for well over 30 years. And I brought him on the show because I think it's important to go over the benefits of chiropractic adjustment, not just for post-trauma, but for preventive maintenance. So without further ado, I bring you Rockin Dr. Troy Mauvais. What's up?
Hello, everybody. I'm so glad to be here. Thank you so much, Mickey, for the invite. And, our personal friendship does go back a few years. And so we are definitely buds. And yeah, I do have a professional life and a fun little hobby life. And so we're going to chit chat about some of that. And I hope we all have a good time today.
Oh my gosh, it's going to be so good because, like I said, I called you Rockin' for a reason. We're going to have a little special surprise later in the show. But to kick this off, why don't you give the listeners who you are, where you work, and then after that, we'll go into why you chose the profession you're in.
So obviously, the name's on the screen. I'm Dr. Mauvais, working for a company called The Joint. The Joint is a kind of a new, upcoming for sure, way to do chiropractic care. I mean, most people traditionally think of a private practice with a solo practitioner in there at one specific location. The Joint is more of a network. And so you've got all of these locations all across the country, tons of them in California. And basically, it's kind of like when you go to Kaiser and you go to one location, you couldn't go to another one, and your records will follow you. So it's that same concept. You just have a licensed chiropractor in all these different locations, and now you have those, if you're a member of the Joint, at your fingertips for you to treat and continue with your program, pretty much essentially anywhere. My specific role right now has been elevated. For the longest time, I've been in private practice, been at a couple of these different local Sacramento locations, and I have recently been promoted to a more managerial level. My official title is the regional clinic director, and the region that I'm in is the Sacramento region, and that's kind of a big region. We've got clinics all the way out to Auburn, Folsom, Elk Grove, all the way, my furthest one is in Vacaville. So it's a large territory. I'm excited, I'm challenged, maybe even a little nervous, but we're going to have some fun. We're going to continue to watch this company grow, and Sacramento is one of our stronger regions, and you're going to see more locations popping up and the name recognition getting stronger. And it's just a wonderful opportunity for me and for, your listeners here to, if they haven't checked us out, to pop in and see what this is all about.
Absolutely. Because I've worked with you actually with the Joint. So going back to it, Dr. Mauvais, you and we've been friends for about 10 years because I met you through a mutual friend who's in music, and she comes to see you, Lydia, comes to see you back when she was doing the avid rock and roll thing.
She did. She saw me when I was in private practice.
Yeah.
She has these flare-ups in her neck, and they get bad. I mean, really, really bad, where she doesn't have hardly any motion to turn. So yeah, that's where you and I hooked up.
And I remember getting my first adjustment from you, and it was like this all-over adjustment. And I couldn't get over how right after that one adjustment, I was able to bend over, knees locked, and I could put my palms flat on the floor, and I swear I was like an inch or more taller.
I remember you doing
that. Yeah, after you gave me that full adjustment, it was the most amazing thing ever. And then years later, I worked for a short stint for the Joint. In fact, I started in a clinic with you,
right,
and it was so much fun, and I learned even more the importance of chiropractic adjustments and even the science and the study and the experience behind doctors.
Yeah, and all the different conditions. There's a myriad of things. People don't just come for neck and back. There's a lot of different things that chiropractors can do.
And we'll definitely touch on like the differences between alternative medicine with the chiropractic versus like a medical doctor. But before we get into that, why don't you share with us what inspired you to go this route and become a doctor of chiropractic medicine?
Sure. So, I got my exposure to chiropractic care very young. When I was, I can't remember the exact age, but I had gone to a chiropractic visit with my mom, who was treating for injuries from a car accident. So I was watching her go, a couple visits in, and I was just amazed at this chiropractor doing these things that weren't drugs, weren't surgery, weren't the typical invasive stuff. And she was just getting better. And so that was the first spark. And here I am kind of young and not really thinking about a career, of course, at that age. And then later I grow up and I'm doing some other things. and working in a restaurant and got myself an injury and went to a chiropractor for a neck thing. And they did some things on me, some quite amazing things that worked so well, so fast, that I, again, was impressed at the fact that you could do something for an injury or something for a person's health without having to do those things that we typically think are the routine procedures in the medical world. And then as I got a little older, I realized that you can't make a living playing Frisbee all day. So I went to school and became chiropractor and started practicing and was basically sharing that same technique with as many people as I could.
That's what did it. Oh, see, usually it isn't a personal experience, I think, with people when they go into the profession that they do. And so, and I'm so glad you do. And so, what are some of the differences between, and I remember this when I worked with you, that the training a chiropractic doctor goes through, it seems like there's more to it, like added to it, than per se a medical doctor.
Well, here's the deal. I don't want to get into the hundreds and hundreds of hours because that gets kind of boring. But
yeah,
in a nutshell, the chiropractor is going to train very, very similarly to a medical doctor as they go through those first few quarters of their schooling. They're learning a bunch of diseases. They're learning a bunch of conditions. They're learning a bunch of terms and a lot of anatomy. But then when it diverges, medical doctors start learning a ton about medications and basically crud and toxins that you're going to put in your body. Chiropractors start learning about how to physically do these things called adjustments. And so we get good at using our hands to actually help people. And so there's a big difference in that philosophy and the way that divergence really spreads apart, because medical doctors just stay in this lane where, waiting for somebody to have an urgent problem, doing something for it, and then letting it run its course. Where chiropractors are, they're going to help people with urgent problems, and we're good at that. We'll get you better if you've got a neck problem or a back problem. But we're also very, very attuned to the fact that these kinds of things just don't always go away. You're probably going to have issues that reoccur. We all live in a world that has gravity, and we do things, and things happen, as the bumper sticker says. So we as chiropractors want to provide a way to relieve that, and we want to give you an option for how to prevent that so you can live a happy, healthy life without these kinds of flare-ups hopefully ever coming back.
And that makes sense there. And that's the thing that I learned, where, of course, no one's saying one is better than the other. They're actually, to me, two separate important things. Medical doctors, it seems they're more trained for the post-trauma, like after something bad happens to you, then they figure out how to bring you back as close to 100% as possible. Where with chiropractic care, it is continuous, because it's part of that exercise regimen, stretching. It's part of being healthy of what you put in your body, what you
100%.
put in your mind, and then adjusting the body to keep everything flowing, if memory serves, right?
Yeah.
I mean, because
here's a quick analogy. Let's say you go to a medical doctor with a headache or some kind of pain. They will give you a medication. You take the medication. If the headache goes away, you don't expect to take that medication the next day or the next day or the next day. Right. But the analogy for chiropractic care is this. Let's say you go to the gym and you go once. Well, the benefits of that are going to fade, right? In a couple days or a week. And so the chiropractic analogy is best and most similar to going to the gym. You go to the gym 3 times a week, you're going to make progress. You drop it down to twice a week, you'll still proceed a little bit. When you go to the point where you're just going to the gym once a week, that's basically a maintenance level. And chiropractic care is exactly parallel to that. The reason why, it's the exact same tissues, muscles, tendons, ligaments that are responding at the gym when you do what you do there, that are responding to a chiropractic adjustment when we do what we do.
Exactly. In fact, I just came and saw you the other day for an adjustment, and I didn't even get to say this in the beginning, but congratulations on your promotion.
Well,
because I've noticed the clinics have grown since, because I think I stopped working there
tremendously.
2000, when is it? 2016, I think, 2015.
Yeah, I started there,
and then it was like 7 clinics, and I think now it's almost twice that, isn't it?
It's 15. Mm-hmm.
Shoot, that's incredible.
And the volume is tremendous. I think when you and I worked together, we would see 20 to 40 people a day. Yeah. Some of these clinics are over 100 now, and so we're adding second doctors on those same sites to make sure that doctor doesn't experience burnout, and then we got that quality care so people can get in without having to wait a ton of time. But yeah, these are, as opposed to perhaps doctors in private practice where they're probably struggling. I know that was the case for me back in the day.
Yeah.
These clinics are exploding, and the trajectory is the sky's the limit. It's going up.
And it's a win-win because doctors like you get to do your practice, you get to help people, and you still get to make a living at doing what you love. And that's the thing for people to understand. If you've either never done chiropractic or you've done it and it's been a while, what the Joint offers is it's going to be opposite than when you go see a regular doctor, where it takes forever when you book an appointment, and then it could be up to a couple of hours from getting there, waiting room. This doesn't happen with the Joint. You don't need an appointment.
Yeah,
Exactly.
That's probably one of the things that people love the most, because you think about it. You've got a chiropractor on whatever the other side of town. You call them up, set up an appointment. It's going to be a couple weeks down the road.
Yeah.
So you go down there. Or let's say you can't make it. Oh my gosh, I got to cancel. Oh, I didn't cancel in time. They're going to charge me for the visit.
Yes,
so if you do get your appointment, yeah, you're going to have to go in. You're going to wait, and I mean, it's just, that's ridiculous. That's a hurdle that is not necessary. So
see, and that's a great thing. It's like, and you can have a favorite doctor. Like, you're my favorite doctor. I will drive to the ends to come see you. But the flip side is, if I have something that flared up, we have this. I woke up sleeping wrong, or I leaned weird, and now I've got this pain. I can just go to the nearest location, and any doctor is going to take great care of me.
Yep. Everybody has a smartphone. Pull it out, open the maps, put the Joint. You'll see where the closest locations are. And we're picky when we hire doctors. We do hire good doctors. We're not about just finding somebody that just needs a job. We're gonna check and make sure they're a good fit.
Which is awesome, and that's good to know. Especially, I mean, man, I can't get over it. It's still reeling in my head that you have 15 now, and you 15. Oversee these. That's even more insane. Good for you.
Well,
you are definitely
for
busy.
A couple more in maybe the first or second quarter of 2021. You'll see some more of these popping up.
Nice. And then let's go over like another myth. Are you actually cracking bones? What is that sound that people hear when they get their adjustment?
I've never heard this question before. It's so weird. Yeah, this is a question that everybody wants an answer to. And there's a follow-up question like, is it healthy? I heard that you're not supposed to crack your knuckles, blah, blah, blah. So yeah, cracking bones, that already sounds wrong, because it's not the length of the bone towards the middle of the bone that we're doing our adjustments. It's at the end where there's a joint. When two bones come together, there's going to be a movable joint. That's where the adjustment actually happens. And the adjustment happens in its normal range of motion. The adjustment occurs in a safe place for that joint to experience motion. It's just a place where it's not really moving through that range of motion when you do your normal activities and move that arm or leg or neck or back. It's a range of motion that's kind of at the end range of motion, still very, very protected by bony structures that don't allow it to get damaged. And it just takes a certain amount of skill to get that joint set up to tension to where it's ready to receive this adjustment, and a certain precise amount of force that is got some force to it, but it also has some control to it. It's an amplitude thing, so that's where the training comes in for these doctors that we have working for the Joint. It's a skill level thing. And then the sound that you hear really has to do with the synovial fluid that's inside the joint. So every synovial joint has a capsular ligament, and that holds the synovial fluid inside there. And that synovial fluid is made up of substances. Some of those are gases that are dissolved in the fluid. And when you do an adjustment, it gaps the joint, and some of those dissolved fluids come out, not outside of the capsule, but come out of the fluid itself. And it's kind of like when you open up a bottle, you take the top off and you hear that fizzing sound, except for the gases escape in that example. In my example with the joint, the gases make that noise, but they don't escape the environment. So therefore, as time goes by, 20 minutes, something like that, those gases become reabsorbed in that joint. And that's why this process could happen again at some point, even later that same day. And then that follow-up question about whether it's healthy or not. There have been studies. There have been people that have, been very young and taken x-rays of their hands. This is one of the most famous studies. This particular individual just did all of these knuckle crackings and mobilization techniques to one hand only through his whole life. And then later in his life, he's 50, 60 years old, takes the x-rays of both hands again, and lo and behold, they look identical. It doesn't matter whether you do a bunch of knuckle cracking to one side or the other. It does not damage. It's just something that moms don't like, so they tell their kids, don't do that.
Don't do it, because they don't like the sound of it, because it's like, it's equivalent to nails on a chalkboard.
Perhaps.
So, and that's great for you to explain that, because I think there is that myth for people who fear it, that they think that they equate that sound with bad.
Another big myth is if you adjust your neck, you're going to hurt somebody. That is a rare larger than 1 in a million type of scenario. So, I mean, when it does happen, of course, it makes big news, and then all of a sudden chiropractors look bad. But this is very, very rare. And I mean, the if you boil it down, a lot of patients, they don't want their neck adjusted because of something they saw in a movie, which is kind of silly. Those actors did not die.
No, they didn't.
I'll tell you that. And then the other thing, if you want to look and follow the money, as they say, the malpractice insurance for a chiropractor is extremely low, as opposed to when compared
Medical
to the
doctors,
malpractice
yes.
insurance coverage for an anesthesiologist, one of the highest. So, they pay hundreds of dollars a month, maybe thousands, to be, protected from claims that they anticipate will sometimes happen. Chiropractors, I mean, I'm insured for $46 a month. So it just doesn't happen.
Nope. In fact, that's an important factor to bring up, and that's part of the reason why a lot of medical insurance can be so high, because part of what they're including is malpractice situations. Unfortunately. And the thing
That's
too
a whole
is
topic too.
Oh, I know. And the thing to understand too, and I want listeners to realize, is that you're working cohesively with your doctor when it comes to chiropractic care. You're working as a team. So
Sure.
what this means is it isn't all just on the doctor. It's also on you as the patient.
Oh,
And
absolutely.
I've noticed that my adjustments do a lot smoother if I've at least warmed up with some sort of walking or exercise before I come see you. Because it's that phrase I've heard, the cold crack. Again, no one's actually cracking, but like the difference between the cold adjustment versus the warm up adjustment. So because these visits are really quick. I mean, as much as you love your doctor, you're not going to sit there and converse. It's like, honestly, you can go in there, you put your card, it scans you in, you lay on the table, and literally 2-3 minutes, if that, you're out. So if you can get yourself warmed up, stretch, even like a little brisk walk around or a jog, you're going to find it's going to be such a smooth adjustment. It's not going to be as loud. Your body's going to thank you for it, and you're going to get the most out of that adjustment.
One technique we like to use too is, if you do come in, if you are waiting for a moment, lay on a table and wait, face down, where you're not sitting there with gravity, poking down on that spine of yours.
That's a great idea.
That's a great way to just begin that relaxation process before the adjustment. It certainly helps, because most people are coming in from traffic and stuff on their mind, and they, just barely set their phone down. And so there's a lot of stresses in our lives. And so just take a moment, breathe and relax, lay on that table. I'm going to backtrack a little bit. You mentioned something I think it's worth bringing up, that, there are times when the chiropractor and the medical doctor have to work together. There's definitely cases that we as chiropractors see that the patient's there, but they're in the wrong place. This is not the kind of care that they need right now. So we as chiropractors, we are portal of entry providers. So you can walk in off the street. You don't need a referral to see chiropractors. So we need to be able to quickly discern and figure out whether this is a chiropractic case or not. And when it's not, I'm the first to let that patient know. What I want you to do is place a call to your family physician and ask them a little bit about this. We need some other eyes. We need some other diagnostic minds in on this particular problem. It may not mean that they're still not a candidate for chiropractic care, but I still want them to follow through on something that I feel might be outside my scope.
Thank you for bringing that up, because I did forget to mention that even though the visits are quick, your initial visit is going to be thorough. You will fill out some forms to give the doctor information on you that stays, and it's protected, of course, just like any other medical information. Your information is protected, but whichever doctor sees you will have access to that. And so that when you sit and talk with the chiropractic doctor, they will ask you what's going on with you. If you're not being seen for something specific, like some people do often go in because they had a fender bender and they had neck injury, or they were playing a sport and they had some sort of like back injury. But if you're just going in for regular maintenance, that's something versus I hurt myself. And the doctor will ask you, so what are we seeing you for today? You've done it every time. So how's it going today? How are you feeling today? Anything different from the last time?
The way it most of the time progresses is it's the pain that some people feel that's their motivating factor to come see us. So we get them all the time with pain. That's usually what that first visit's all about. Hey, I tried to move my a bag of cement and sprained my back. I was on a trampoline and hurt my neck. Those kinds of things are really what drives people in. Pain is a strong motivator. Once they get in, we do our evaluation. We figure out if they're a good chiropractic candidate. We do as much as we can to help them, give them treatment recommendations for follow-up care. And as they go through those follow-up visits, we're hoping that those pain levels are going to come down to, at some point, they are a maintenance patient and they're coming in with, hey, how you doing today? I'm doing great. I have zero issues. I just want to maintain the benefits that I got from the first little while we were working together. So that's the progression.
Yes, and that's important to note, is that if you don't feel pain, that's a good thing. And if you don't feel pain, doesn't mean you stop going. In fact, it's because you're going once a week minimum is why you're experiencing no pain. In fact, I come to see you whether I've got pain or not, because I know it extends that ability to not be in pain. So here's another question. Is there an age limit, or can pretty much anyone get an adjustment, and why?
Well, there isn't really an age limit. You know, you could adjust a child. Obviously, that child adjustment is going to be quite different than, you know, a full-grown man, but it doesn't mean they can't be worked on. I've adjusted all three of my children from very early in their age. We have an 8-month-old in the practice right now that's coming in. His mom says, you know, he's not sleeping well. He gets adjusted. He sleeps well for a night or two, gets adjusted, sleeps well for a few more nights. You know, so we treat children, we treat all ages. I have some elderly folks that come in. Again, obviously the elderly, you're going to do and perform these procedures in a different way. But like I said before, our chiropractors are well trained, and they have different methods, even different instruments at their fingertips to allow them to address just a myriad of cases.
See, that's beautiful. I love that chiropractic isn't just, you know, in the direction of a certain age group or a certain type of person, like anybody, almost anybody, with the exception, of course, if you have something severe going on with you. But
there are contraindications, but I mean, yes, it's for all ages. It's for all, you know, athletic types. It's for, with the joint, it's for all financial, you know, classes. We don't want chiropractic care to just be for the rich. So we have this priced at a point that almost anybody can afford.
Totally. I mean, I stopped working there, but I still have an account and I still come and see you.
Right.
I mean, I've seen other doctors. The doctors are great, but I just love you. So, and it's just good to see you. Now, we'll go back into chiropractic, but I wanted to kind of touch on something that you've been doing a little bit longer than chiropractic, and that's music.
I am a big music fan.
Yeah.
I've been
touch on
playing, you know, these 6-stringed instruments and 4-stringed instruments since about age 16. And, you know, it's one of those things. It's a bug. You get it. You might try to put it down. Like I put it down a little when I was going to college, you know, but then all of a sudden there was a talent show and here I am again. So it's just one of those things that just keeps popping up. Music is sort of addicting. It's fun. It uses a different side of your brain. And I think that's a good balance. It kind of gives you an outlet from maybe being so clinical in one part of your life to something that's a little more carefree. So I enjoy playing music. Because
I see you've got quite the array of guitars behind you.
Yeah. Oh yeah. You want to, I got this one here too. Check this.
Uh-oh. Show me.
This one, so you'll be able to hear it. It's an acoustic.
Ooh.
So we could do something really gritty, like a little bluesy thing, you know, or we could do some middle of the road chords. Or some like jangly cowboy chords, you know, like chiropractic care. It's a drugless, surgeryless way to improve your health. It's the way to go. Yeah, it's the way to go. So music is a fun thing.
That was beautiful. Look at you just coming up with a song about chiropractic care.
Adam Sandler just, you know, kicking it with the guitar and
completely
making up silly lyrics.
So because I remember when I met you, you also, when you have time, you play in a cover band. How many songs did you learn to play? Not just for that, but overall, would you say that you know?
We try to keep a repertoire that's large, you know, 70, 80, sometimes it's been as large as 90 songs. But, you know, every once in a while you'll have band members transition in and out, and then you kind of back down to those core songs that are, I would say, easier, and we can just knock them out without too much trouble, build a set list, and go out and go. Now, COVID's, you know, kicked that in the tail end a little bit, so we haven't had a lot of shows to do. The last one we had it happened to be up in El Dorado County, so they're a little bit more open. But, you know, we're just trying to still kind of kick it in the woodshed and keep it alive, and then who knows when we'll be able to get out there a little more often.
Yeah, hopefully sooner than later. I know some places have been able to do outdoor patio playing because some restaurants have been fortunate and they have the space to have outdoor seating. And then from there, some places have hired people to perform, you know, so there's that distancing. But I mean, I mean, because you pulled up your guitar and you're like, we can go blues, or we can go rock, or we can go jazz, or we can go country. How many genres can you play?
I only pick the ones that I like. Unfortunately, I'm not a big country fan, so we do like one or two country songs. I like the alternative rock. That's my favorite. It just has a good drive. I like the drums and bass just cooking away, and then they're just fun to sing. They're lively.
I just love that you do music. I just love it, and you're good too. Anyone who, if you're following this podcast, and check out his band, it's called Remedy, and sooner than later, we're hoping when things open back up, he'll be out there performing. He sings. He's a great singer. He's good at playing his guitar. So, sliding back to chiropractic. Have you been able to see patients despite things being shut down because of COVID? Because I know that's an important question people wonder about.
Excellent question. I'm glad you brought that up. So what happened in March was everything shut down. So many businesses were closed. It was kind of like unprecedented. The Joint is obviously a medical providing services. So as medical providers, we are essential, so we kept our doors open. Now, volume went way down. I mean, we went down to probably 50% of our normal traffic of folks coming in for their regular visits. They were just hunkered down, but we stayed there, and we upped our cleaning procedures. The procedure now is every single table gets completely and totally wiped down with a hospital grade sanitizing wipe. Right after a patient has been seen and leaves that area, that table is allowed to dry for a certain period of time before paper is reapplied and we can have our next patient in there. Obviously, there are some other precautions. We're all wearing masks. We've got, some other cleaning protocol for door handles and restrooms and, other chairs that might be sitting in the reception area. But the biggest concern, I think, is when patients walk in, they want to know and be comfortable that they can climb on a table and lay face down, put their hands on a little resting pad. And by gosh, we are about the safest place you can be with all of these sanitation procedures that we have in place.
And I can swear to that because my daughter and I have been hunkered down. We don't really go anywhere. We're mostly inside. We don't travel. We bare minimum shopping if it's groceries, if we don't have things delivered. And I've been to 3 different of your locations. Like the third one was that one. I didn't even know you're located in the Safeway Plaza.
Midtown.
Downtown, in Midtown. So everybody, if you're down over there, you go to that Safeway off of 19th. They face S Street on 19th.
Yeah, that's our cool urban city location.
Yeah, totally. And it's very clean because you already roll out that disposable paper like that you're face down on and turn your head up, and that gets changed every time.
Sure.
And you can smell how clean the clinic is. The clinics are just kept top notch clean, and you do have more than one table. You did mention about being able to go and lay down. It is an open thing. That is, people need to understand. It isn't a private. Yeah, it's an open bay. It isn't a private one-on-one, but you're not there long enough. You're fully clothed. People are not paying attention. People are not even listening. They're just in there to get the adjustment. I mean, and if you had to, like if there was something that a patient wanted to talk about, would you be able to accommodate being able to at least have that initial discussion?
For that, if somebody's got a private issue, and that happens occasionally, it's rare, but we would just say, hey, we can take you right back this way. We've got a break room or a lunch room. There's always a separate room that you can close the door in. So if somebody had something significantly private, they would be able to confide in that doctor and do that without a whole bunch of other people. But, the vast majority of folks that come in are beyond that part of describing what's going on and, any kind of traumatic events or any other incidents like that. Most people are on that wellness part of their care. They are simply coming in for a maintenance adjustment with really not that much to report unless something new and different had happened in the last week. It's usually just, all right, I'm feeling pretty good. Let's go ahead and get another adjustment done and I'll catch you next week, doc.
That's it. It's that quick. It's that thorough. It's that positive. It's that uplifting. You can go in between when you're shopping, like at Safeway. If you happen to be running errands, you can run in real quick, flag your little card, get your adjustment, and then go on your day. So what are the hours of operation for the locations? Are all of them like 7 days a week or some of them? I mean, you're usually at least 10 in the morning you open, I think?
Yeah, and people love that convenience. I mean, people are, moms are pushing their kids in the stroller. They can just push them in the corner, get on a table. Business guys are on their phone, set that down, get an adjustment. So not to ignore your question, but just to kind of still reel in on the convenience of that.
Yes.
We know people are busy. And so this is something that people want. And the Joint is poised to give that service that people already want and be that spot, that niche type of chiropractic care for them. Now, as far as hours, all of our clinics start at 10 a.m. every single day of the week. Some clinics are not open 7 days a week. Some are 6 days a week. But with the volume and the way this company is growing, I anticipate every clinic to be a 7-day-a-week operation at some point. Not tomorrow, but they just are continuing to grow. So it'll happen. But they're all open 6 days a week and some 7. And the operational hours on the weekdays are 10 to 7. And then those weekend days, if it's Saturday and Sunday or just Saturday, those hours are 10 to 4.
And those are really helpful hours. I mean, even to be open 6 days a week for medical practice, for adjustments, I think is key because like we mentioned earlier in this podcast, with doctors on medical, it's scheduling the appointment and often there isn't a weekend. You know, or if you need to be seen, now you're in the ER and now you're waiting. And then it's the level of the importance of what you need. And chiropractic just takes all that away.
Yeah, the Joint just removes those barriers.
It does.
Yeah, those evening hours are super popular in that Midtown.
Oh,
location.
I bet.
We see a lot of 5 to 6 to 7 o'clock people rolling in because they're done with work and they want to get this done and then go home.
It's your business rush hour.
Yeah.
It's the chiropractic rush hour, that 5 to 7 slot.
Yep.
That's so great. And so then to recap on all the conversation we have here, chiropractic is definitely a preventive maintenance routine, not just after you have an injury. You definitely want to be seen regularly. The prices, pretty much anyone can afford them. They have in fact, you have all kinds of packages too, don't you?
Yeah, we didn't
can
get into pricing because sometimes that just seems like a sales pitch. But yeah, we have 3 or 4 different things available. You can buy visits one at a time. You can buy them in groups. Our most popular plan is more of a membership style. Pay you a flat fee, get a certain amount of visits. If you need more, it's more affordable even after those visits are used up. So we've got several options. I always tell people we've got something for everyone.
And that's the importance, and that's the reason I brought that up, is that there isn't a limit, and they will find a way to work it into your budget because really the importance is it's the investment in yourself, in your own health and well-being. I just turned 52, and the more I cannot go see a regular doctor and be put on medication and told I need surgery, the better. Yeah. And chiropractic care is one of my top priorities for making sure that I'm going to live to be 112.
Yeah,
so
let's say if you delivered packages for a living or you work, construction, those guys depend on their bodies to make a living, to bring food and stuff home for their family. So you do have to invest in your body. And the investment isn't huge at the Joint as opposed to what you might think of if you've been to a chiropractor in private practice. And sometimes their prices are just prohibitive. You're not going to be very compliant with a program that's going to cost you hundreds of dollars a week.
Very true.
And that's not the case at the Joint.
Which is perfect. So I want to thank you so much, Dr. Rockin Troy Mauvais, for taking your time out. Because now that you're this busy regional director, you're overseeing 15 clinics. So thank you for taking the time and for playing that song and for letting everybody know how important and how accessible and how affordable chiropractic care is.
Yeah, well, I appreciate the invite. It was a pleasure being here. If you see me driving around town in the Joint Mobile, honk and
say hi.
I'll be moving all through the whole region.
Will do. This is Myki Angeline with the Bad Filipino signing off, wishing everyone a great weekend. Take care.